From the KBIA Newsroom in Columbia, I'm Finnegan Bello. A pair of St. Charles Republicans have filed legislation that creates infrastructure requirements for data centers. As Sarah Kellogg reports from Jefferson City, lawmakers say the bill is not intended to be anti-data center.
The bill creates new requirements for data centers regarding electricity and water usage. Representative Mike Koslow is a sponsor of the legislation. He says the bill requires large load consumers, like data centers, to pay for the necessary costs to provide them with electricity, such as grid infrastructure upgrades.
We have to make sure that that cost is not passed on in any situation to consumers. We want to protect our residents first before we start to look to reap the benefits of this kind of investment into our state.
Koslow believes Missouri has a lot of strengths that data centers are looking for, like an abundance of water and cheap power. He and his colleagues say Missouri is a place where data centers can operate with little impact if the right guardrails are put in place. In Jefferson City, I'm Sarah Kellogg.
And measles vaccine exemption numbers across Missouri have increased over the past few years, according to the Missouri Department of Health and Senior Services. The Columbia Missourian reports in 2025 there have been confirmed measles cases in Cedar, New Madrid, and Taney counties. Measles is one of the most contagious diseases in the world, spread by coughing, sneezing, or rebreathing contaminated air. Missourians needing prosthetics could get insurance coverage for multiple devices under a proposed bill. The bill heard Thursday would require MoHealthNet, Missouri's Medicaid program, to cover additional prosthetics appropriate for water usage and physical activity. Missouri Insurance Coalition lawyer Hampton Williams says the Trump administration's threats to dismantle federal funding for the Affordable Care Act could mean Missouri needs to pay all the costs of the prosthetics.
Should the federal government change the manner in which it has been interpreting and applying the ACA, it would require the state to pay for not only the expenses for mandates for the cost it covers, but also those mandates for private insurers.
Supporters of the bill argue coverage for the additional prosthetics would reduce long-term health care costs. And disability advocates gathered at the Missouri Capitol Wednesday to push back against Governor Mike Kehoe's proposed cuts to disability services. The governor wants to cut about $28 million from programs which help those with disabilities live more independently. Easter Seals Midwest lobbyist Kathy Brown says the cuts would mean delays in Missourians accessing benefits.
Well, budget cuts will have a real and immediate impact on people with disabilities and their families. Services might look different, services might be reduced, and people might go onto waiting lists.
Brown also says the state should not eliminate income taxes or reduce property taxes, both of which help fund many state-supported disability services. I'm Finnegan Bello, KBIA News, Columbia.